Cosmetic surgery has undergone tremendous changes over the last 20 years. As a dermatologist, I've been fortunate to be involved in many of those developments. The first big change was liposculpture. An American dermatologist, Jeffrey Klein, developed a technique called tumescent liposuction. That's a fluid technique where water goes into the fat and it softens the fat and allows us to suck out fat in a smooth and fairly safe method. We can remove many litres of fat from all over the body just in one setting, and the patient can choose whether they're awake or asleep. The other big development was about 16 years ago, and that was the introduction of lasers. Lasers are used to vaporize wrinkles around the mouth, get the skin all fresh and clean, and remove things that we don't want, like blood vessels, pigmented spots, tattoos, brown marks. Those lasers can sometimes be used in conjunction with liposuction, and we use a technique called a vaser liposculpture, which allows us to develop a high definition of liposculpture. Let's have a look at what's happened over the last 20 years. The big breakthrough, as I said, was 1992. I was fortunate enough to organise the actual very first conference to bring out that technique to Australia, and that method has really changed. 1994 was the development of lasers, and lasers could be used to remove wrinkles and to remove lots of unwanted spots, even unwanted hairs. The concept of using a laser as a highly powerful source of light to modify it in such a way that it can be used as a beneficial effect on the skin. We started to develop more confidence in the techniques of liposculpture. We started to apply it on patients who are actually overweight and giving them a kickstart so that they could change their lifestyle and suddenly remove many litres of fat. And sometimes we remove 10 litres of fat in one setting. In the development of breast reduction through liposuction, I performed the first big study, and we were able to remove many litres of fat from patients and get a reduction without the need for a true surgical intervention. Just by suturing the skin and lifting this outer skin of the face upwards and outwards. 7 or 8 years. And the real breakthrough for men was down here in the year 2009, where I travelled overseas to learn a technique called vaser liposuction. I travelled overseas to learn a new technique called vaser liposuction, which allows me to sculpture the stomach to produce that really nice athletic six-pack look. Men also come in now to have the man chest boobs removed, and we can talk about that another time. Introduction of a fat bank, because now we can store patients' fat in specialised banks and allows us to use the fat and stem cells in the future for other cosmetic work.